Hello, Lisa Broyles with Way 2 Health MD, and this is the next installment in my inflammation series. Today I am addressing the respiratory system. This is how well we all breathe. So if you're suffering from symptoms like chronic sinusitis, stuffy nose, drippy throat, always clearing your throat, coughing up phlegm, maybe you have asthma or COPD, emphysema, these are all symptoms of inflammation of the respiratory tract. So how does this happen? The typical causes are infectious. So you've gotten a pneumonia, a virus, a bacteria that has caused damage to your lungs. Usually that's not chronic, although in some cases with long COVID, we have seen some damage to the lungs that does tend to perpetuate. However, usually it's short term and then it resolves with treatment of the infection or resolution of the infection. The other cause is inhalation of toxic substances or fumes. So if you're sensitive to mold, it can cause a lot of chronic sinusitis and mucus congestion. People that are sensitive to mold that live in a moldy environment can also often have nosebleeds, feel brain foggy, just chronic headaches and mucus production and feel quite terrible. And someone that isn't sensitive to mold can live in the same house and not have any of those symptoms. So there is a genetic predisposition for certain people. We estimate it's about 20% of the population here in the US that is sensitive to mold. When they inhale it, they can't excrete those toxins and it builds up. You can even have mold biofilms that build up in your nose and lives in there, or in your stools, in your gut. So there is testing that doctors can do. I use a company called Microbiology DX to get nasal swabs to see if there are indeed molds or bacteria that have set up in the nose to cause chronic sinusitis, and then I treat accordingly with compounded medications. And you also need to remove any of the offending fumes. So if you are sensitive to mold, you have to have your home remediated. If you are smoking cigarettes or marijuana, you have to stop. So anything that you are inhaling that is causing damage to your lungs, you have to remove that offending agent. There are some supplements that I do use to help people with chronic lung diseases like emphysema and mucus production. Typically, these supplements have quercetin, which is a natural antihistamine. They usually have some magnesium, some stinging nettle. So there's a company called LifeSeasons that makes two different products that I've had pretty good results with. One is called Lung Capaci-T, and that's a T at the end of it. And the lung capacity helps thin mucus and make less mucus. So that one's good for people with chronic COPD or emphysema, people that used to smoke or even are still smoking, even though there's ongoing damage, that can protect the lungs some and reduce that mucus production. Their other product is called Breathe X, and I like their extra strength version of that. That's usually 3 capsules once daily, and that's helping with allergy type symptoms where you're just feeling more stuffy and again, mucus production. But those two products are a little bit different from each other, but I have had good results with them. So if you're suffering from a lot of mucus production, sinusitis, that is respiratory inflammation, it can be resolved with looking for an infection and treating it, or looking for what toxic substance is causing it and treating it. There are multiple herbs available, like I mentioned, the Quercetin, for example, but typically they need to be in a blend. During COVID, I typically will prescribe compounded nebulized glutathione to really help those lungs heal up and protect them from damage. If you have any further questions, I would love to talk to you in person about respiratory chronic inflammation. Thank you.